Dear friends, today I want to start with a very important warning. The year 2026 is going to bring some of the biggest changes yet concerning retirement benefits, Medicare, SSI, SSDI, and the entire Social Security system. And these changes won't just affect a small group. They will directly impact millions of people, including those of you watching this video. Our title today is 10 Social Security Changes for 2026, affecting millions, including you. I say this as someone who closely follows reports, policy updates, and the real-life stories that so many retirees share with me every day. We are entering a phase where simply misunderstanding one rule, submitting an application at the wrong time, or missing a small notice from Social Security could cause you to lose hundreds to thousands of dollars every year without you even realizing it. And the reason I'm making this video is to protect you. Because if you understand these 10 changes, you will keep your money. And if you don't, unfortunately, you will be the one losing out. Part 1. COLA 2026 increases by 2.8%, but doesn't fully offset inflation. I want to start the first section with a number many of you have heard, but not everyone fully understands its implications. The 2026 COLA will increase by 2.8%. COLA, or cost of living adjustment, is designed to help Social Security recipients maintain the value of their income over time. However, in reality, over the past few years, COLA has often lagged behind the rising cost of living, especially for the goods and services that older adults must rely on. Starting in January 2026, all recipients of retirement benefits, SSDI and SSI will see this increase. But when we put it in the context of the current economy, we have to acknowledge that 2.8% won't make a huge difference. Food prices have been rising continuously over the past 2 years, winter electricity and gas costs in many states continue to climb, and medication costs, even with Medicare Part D, remain a major burden for retirees. This is why I say this year's COLA is more symbolic than realistic. In many discussions, I've been asked whether the COLA increase will help stabilize finances. My answer is always not necessarily, because if essential costs rise faster than the COLA, this increase only partially offsets the rise, or perhaps not at all. That's what I call the COLA trap. You see your income go up, but when you pay your monthly bills, you realize you're not much better off, or you might even be short. Another factor that makes the COLA less effective is that the Medicare Part B premium is also increasing sharply in 2026. In many cases, the entire COLA increase is swallowed up by Part B, leaving your actual monthly benefit virtually unchanged. For those who rely solely on Social Security for living expenses, this is the most alarming factor. They see the notice of an increase but get no extra money in their account. The real risk isn't the 2.8% number, but the fact that we expect COLA to solve all our financial problems next year. I've met many people who ran into difficulties simply because they thought the COLA was sufficient. But by failing to review their fixed expenses, neglecting to track health insurance costs, or not double-checking their Medicare Advantage benefits, they become reactive, especially mid-year when costs suddenly spike. Therefore, the most important thing I want you to do right now is review all of your essential expenses, especially those that tend to increase seasonally or according to notices from individual insurance companies. Check your Part B and Part D premiums, and if you use Medicare Advantage, clearly review your 2026 benefits because many companies have made cuts that users haven't noticed. I want to stress one last time. COLA is not a tool to help you keep up with inflation. It is only a measure to prevent your income from decreasing in value too quickly. But if you want to protect your wallet in 2026, you need to proactively manage your costs rather than waiting for the COLA. And that's why I put it in the #1 spot on this list, because understanding COLA correctly will help you grasp the rest of our 9 sections. Part 2. SSI rises to $994. Low-income group benefits the most. And precisely because the COLA is not enough to offset inflation, as I analyzed in the previous section, we need to look at the second major change for 2026, the SSI increase. This is a direct assistance program for the low-income group, the most vulnerable population as the cost of living climbs faster than ever. In 2026, the federal SSI rate for an individual will increase to $994 per month and $1,491 for a couple. This is one of the strongest increases across the entire Social Security system this year. Compared to the COLA increase of only 2.8%, you'll see that the SSI adjustment is far more substantial. This is because SSI is designed to support the lowest income individuals, those who are no longer able to work extra hours, or those 65 and older who must live on a very limited amount of money. But there is a big problem I've observed over the years. Millions of eligible people never apply for SSI. I've met many seniors, 70 or 75, living alone, receiving only a few $100s a month, who don't realize they qualify for an additional nearly $1,000 from SSI. The reason often stems from misunderstanding. Many people think SSI is only for the disabled, or they think they're not poor enough. Others believe having an old car or a few $100s in savings means they're ineligible. All of these assumptions are incorrect. SSI has two groups: the disabled of all ages and people 65 and older, regardless of disability. As long as your income and assets are within the limits, you may qualify. This means many older adults are missing out on benefits they are entitled to receive. The impact of the SSI increase in 2026 is huge. For low-income individuals, an increase of just $50 or $100 makes a difference. And at the $994 level, SSI can help many people avoid having to choose between medication and utility bills. This isn't supplementary money, it's a main source of income for millions. However, this increase also carries a risk: complacency. If you continue to believe that SSI is difficult to get approved, or you self-assess that you don't qualify, you could lose tens of thousands of dollars over many years. That's why I always recommend 3 simple steps. Review your total monthly income, check your assets against the specific SSI rules, and remember that this program applies to everyone 65 and older, regardless of disability status. SSI is not government charity. It is a legal benefit you deserve if you meet the eligibility criteria. And in 2026, as the cost of living continues to rise faster than the COLA, SSI is the lifeline I don't want anyone to miss. If you understand this section clearly, you'll see why the subsequent changes on our list are so important. Part 3. Earnings. Test below. FRA rises to $24,480. Following the potential importance of SSI as a resource for low-income individuals, I want to transition to a change that directly affects those who are receiving early retirement benefits but continue to work. This is a group that can very easily lose money without knowing it, simply by overlooking a crucial rule: the earnings test. In 2026, if you receive retirement benefits before your full retirement age, FRA, you can only earn a maximum of $24,480 for the entire year before Social Security begins withholding benefits. This threshold is higher than the previous year, but it's still a level that many people can accidentally exceed. And when you exceed the threshold, for every $2 over, Social Security withholds $1 of your retirement benefit. This means exceeding the limit by just a few $100s can cause you to lose hundreds to thousands of dollars in benefits. I've spoken to many early retirees who often say they're only working part-time, so they definitely won't exceed the limit. But the reality isn't that simple. All it takes is a seasonal hourly wage increase, a state minimum wage increase, or a small bonus for you to pass the threshold without realizing it. Many people are completely blindsided when they receive a notice at the end of the year about money being withheld. The biggest risk lies in the first year you begin receiving benefits. Instead of looking at total annual income, Social Security uses the monthly earnings test. This means that if you exceed the limit in just 1 month, your benefit will be withheld immediately, even if your total annual income remains below the $24,480 threshold. This is a point many people are unaware of, and it's a key reason why they lose money without understanding why. I have seen cases where individuals only exceeded the limit by $120 in 1 month, but lost over $300 in retirement benefits. All of this is preventable by tracking your income more closely. The earnings test is not complicated, but it is the line between keeping and losing your money. If you are receiving benefits early and still working, record your income monthly, calculate potential bonuses or overtime in advance, and be especially careful during the first year of receiving benefits. With the $24,480 limit in 2026, this is not a number we can afford to be complacent about. By clearly understanding this section, you'll easily grasp the next change related to the earnings test in the year you reach FRA. Part 4. Earnings test in the FRA year rises to $65,160. Because the earnings test below your full retirement age, FRA, can lead to unexpected losses, I want to move on to another important change. But this time, it's better news. When you enter the year in which you reach your full retirement age, the earnings test rules change completely. And in 2026, the earnings limit during this period will increase to $65,160. This is one of the most notable increases because it opens up financial opportunities you may not have considered. In the year you reach FRA, Social Security allows you to earn up to $65,160 before they begin withholding benefits. And even if you exceed that number, the withholding rate is lighter than in the years before FRA. Instead of withholding $1 for every $2 you are over the limit, they only withhold $1 for every $3 of excess earnings. Simply put, if you want to accelerate your earnings before entering your full retirement phase, this is the most critical time to do it. I have met many people in their FRA year who mistakenly thought the earnings test was the same as the previous years. This misunderstanding caused them to hesitate about working extra hours, taking on more shifts, or declining a temporary job simply because they feared their retirement benefits would be withheld. Meanwhile, the FRA year is the only year you have a much more comfortable buffer to increase your income without worrying about heavy deductions. However, opportunity comes with risk. The biggest risk I often see is the confusion between the month you reach FRA and the year you reach FRA. Many people think that as soon as they enter the year they turn FRA, the earnings test no longer applies. That is incorrect. The earnings test is still applied up to the month you reach FRA, not from the beginning of the year. Due to this misunderstanding, many people unintentionally exceed the threshold, have their Social Security benefits withheld, and only find out after many months of deductions. Another important point is that very few people plan their income for this specific year. These are 12 crucial months because if you plan clearly, you can fully leverage the $65,160 limit to improve your financial situation before entering full retirement. Many people use this period to work extra hours, complete final projects before leaving work, or receive end-of-career bonuses. But all of this only pays off when you accurately understand the limit and how Social Security calculates it. You need to approach the FRA year earnings test as an opportunity, not just a rule. It allows you extra financial space before you enter the phase of relying solely on your retirement benefits. If calculated correctly, this period can help you build significant savings, reduce financial pressure in the early years of retirement, or contribute to an emergency fund that many people lack. Therefore, I want to emphasize the action you need to take now. Plan your income for at least 12 months before your FRA month. And once you clearly understand this rule, you'll see how the next part of our list becomes even more important. Part 5. Social Security Taxable Income Cap rises to $184,500. Moving on from the changes related to the earnings test, I want to discuss a factor that directly affects those who are still working in their later career years, especially after age 60. In 2026, the maximum income subject to the OSDI tax will increase to $184,500. This change may seem small, but it directly impacts your net take-home pay each month. OASDI is the portion of the Social Security tax paid by both the employee and the employer. When the income cap increases, it means a larger portion of your income will be taxed. With a tax rate of 6.2%, if even a small part of your income falls into this new taxable range, your take-home pay could decrease significantly. This doesn't just affect very high-income earners. Many people between the ages of 58 and 62 receive end-of-year bonuses, change positions, or get raises without realizing they have exceeded the new tax cap. When they see their net pay decrease, they think the company made a mistake, but in reality, they are simply paying more Social Security tax. The biggest risk here is failing to plan your taxes before retirement. Some people plan to retire in their FRA year, but don't account for the fact that their net income has decreased due to the change in the taxable cap. When they start receiving retirement benefits, they find their finances aren't what they expected and are immediately under pressure in the first year. My advice is very clear. If you are working after age 60, review your entire tax profile. Calculate potential bonuses, overtime, or end-of-career payments in advance to know if you will fall into the new taxable income level. By being aware of the $184,500 cap, you will be more proactive in planning your retirement and protecting the money that should rightfully be yours. Part 6. Quarter of coverage rises to $1,890. As we discuss planning in the final years of your career, I want to turn to a change that sounds small, but is vitally important for many people, especially those nearing eligibility for retirement benefits. That is the rule for the quarter of coverage, which will change in 2026. To be credited with 1/4 of coverage, QC, in 2026, you must earn at least $1,890 in that quarter. Each year, you can earn a maximum of 4 QCs, and to qualify for Social Security retirement benefits, you need a total of 40 quarters. This is a requirement that many people ignore until they reach their late 50s or early 60s, only to discover they are missing a few quarters. And being short by just 1 or 2 quarters is enough to cause you to lose lifetime retirement benefits. I've encountered quite a few such cases during my years of work. Some people worked their whole lives but had a long career break to care for family or switch to a job that didn't contribute to Social Security. When they checked their earnings record, they found they only had 38 or 39 quarters, a small shortfall with huge consequences. Because if you don't have 40 quarters, you cannot receive Social Security retirement benefits, even if you've lived and worked in the US your entire life. In 2026, the earnings threshold to get 1 QC increases to $1,890, which isn't a high number, but it's a point where many people become complacent. Some people think that working all year automatically earns them 4 quarters, but that is not the case. Social Security counts income, not the number of hours or months worked. This means that if you don't earn enough income in 1 quarter, you could lose one of the 4 QCs for that year. What I want you to do right now is check your earnings record on ssa.gov. This is a simple step that many people skip. When you check, you'll clearly see which years you had 4 quarters and which years you only had 3, 2, or even none recorded. And if you find yourself at 36, 37, or 38 quarters, plan immediately to complete all 40 quarters before you retire. The quarter of coverage is not a complicated rule, but it is the determining condition for whether you receive retirement benefits. And in the context of the many changes in 2026 that we are analyzing, this is the best time to ensure you don't miss any quarter. Once you're clear on this part, we can move on to Part 7, with a critical change for those receiving disability benefits. Part 7. SGA and trial work. Period increase. Disabled individuals are more susceptible to CDR. For people on SSDI substantial gainful activity in 2026, $1,690 per month for non-blind, $2,830 per month for blind trial work period. Month $1,210. Higher limits sound good, but in practice, Social Security often uses them as a reason to review whether you still qualify for disability. 1 or 2 months slightly over can trigger a review that stops benefits for years. Track every dollar carefully if you try to work. Part 8. Maximum benefit at FRA rises to $4,152 per month. Good news for high earners. The absolute maximum retirement benefit at full retirement age in 2026 is $4,152 per month, up from $4,018. But you only reach that number if you wait until full retirement age to claim. Claiming at 62 locks in a permanent reduction. You will never hit the maximum. Compare age 62 full retirement. Age and age 70 before you file. Part 9. Average benefit rises to $2,071, but Medicare costs increase faster. The typical retiree check in 2026 will be around $2,071 per month. Feels nice until you see Medicare. Part B eating a bigger piece than ever, many will see their net check stay flat or actually shrink. Review your Medicare Advantage or Part D plan. During open enrollment, a wrong choice can cost hundreds extra every month. Part 10, Medicare. Part B rises to $202.90 per month. The hardest hit to retirees' wallets. The standard Part B premium in 2026 will be $202.90 $0 per month, plus a higher deductible. This money comes out automatically before you ever see your Social Security check. For people getting only $1,200 to $1,500 per month, losing over $200 right off the top is devastating. If you do not apply for your state's Medicare Savings Program or extra help, you can lose another $200 to $400 every month, completely unnecessarily. Medicare Savings Program is not hard to apply for. Thousands of eligible people never do it. If Part B is hurting you, file for Medicare Savings Program at your state office today. It is the fastest way to protect your money in 2026. When you understand this change, you will see how all 10 points connect and affect your daily finances. As you can see, these 10 Social Security changes in 2026 are not small tweaks. They are system-wide shifts that touch income, medical costs, work rules, and lifetime benefits for millions. Understand them and act early, you keep almost every dollar you are entitled to. Ignore them or think it will be fine. One tiny mistake can cost you for decades. This video is built from public government data, official reports, and trusted research. We do not represent any agency or company. Our only goal is to give retirees and their families clear, honest, up-to-date information. Thank you for watching. If this helped, please stay with Benefit Report so you never miss the most important 2026 updates. See you in the next one.